Hello everyone. We are going to start to talk about the shoulder joint. And shoulder joint really isn't accurate. It's actually four joints. And let me go ahead and get started and talk to you about what we'll be going over. So if we go to the next slide, here we go. So first steps, make sure before you start any of this or any of the module, make sure you take a pre-assessment. This is really going to help you with your learning, especially when you reflect back on it. And we'll talk more about what that means as you kind of get into the program. But as you look back upon it, it will help you learn a bit more about the way that you learn. Okay, I'll leave it at that. Let's go to the next one. So next slide here. So what we're going to do today is talk about the different bones, bony features, cartilage around the shoulder joint. We're going to identify and describe the muscles, and we're going to focus really on the glenohumeral joint because there's so much to cover. And in addition, just briefly talk about what the other joints are and how they're connected, and then describe the function of the rotator cuff muscles. So let's take a look here. Okay, so make sure your next steps are going to be to look over the shoulder muscle table, and this is after you've taken your pre-assessment, view the 3D models, and then complete the task for this module. And then, of course, at the end, complete your end of module quiz. So what is the shoulder joint? Well, the shoulder joint is a series of four joints that connect basically the upper extremity, or the whole arm all the way down to the hand and fingers, to the rest of the body. So I'm going to get my highlighter here so you can see each of these joints. So the glenohumeral joint is the most common joint that you think about when you think about the shoulder. So here's the humerus, here's the head of the humerus, and this articulates or forms a joint with this part of the scapula called the glenoid. So right here is the glenohumeral joint. Okay. Next we have the acromioclavicular joint. So we're going from kind of distal to proximal. So here, well, I guess these are both about the same. So take that back. But we have the acromioclavicular joint, and this kind of tells you here's the acromion up here. It's a portion of the scapular bone. And here is the distal end of the clavicle, and this is your AC joint, or acromioclavicular joint. Then from these two joints, as we move more medially, this one all the way over here is the sternoclavicular joint. And it's this joint here. This is a very strong joint. It's really hard to dislocate unless it's traumatic. But this is the only connection of the upper extremity to the rest of the body. So right here, this little spot here really has to be strong. And you'll see as you continue your studies over the next couple of years how strong that joint really is. The last joint that I put on here is the scapulothoracic joint, and it's really, we call it a pseudo joint or not a real joint, and it's over here. It's this anterior surface of the scapula articulating with the rib cage, if you will. So scapulothoracic. And these joints, all of them, including the scapulothoracic joint, have to move in coordination with each other in order to really move your upper extremity. Okay? Now your upper extremity, this whole arm here, is really important for a lot of your activities of daily living, like reaching for things, bringing things like eating to your mouth. And if any of the shoulder joints are off, that can really affect a lot of your daily function. Okay, let's start with the 2D musculature. I'm going to start with the pictures, and then we're going to move on to the visible body where I can move things in 3D. Okay, so what you'll see up in the corner here is the view. Okay, so this is an anterior view. There's some that are not labeled, and that's because they're either lateral or superior or something a little bit different. But from an anterior view, if we're looking really superficially, right underneath the skin is your pectoralis major, right here. Okay, just going to go ahead and insert right on this, well, you'll see the groove here that it inserts on the humerus. Okay, you need to peel this away in order to find the pec minor. So you see the pec minor has a slightly different orientation. It's attaching to ribs, usually like 2, 3, and 4, or 3, 4, and 5. There's some variations there. And then it attaches underneath to the coracoid process. This is a deeper muscle, and in order to get to this muscle, you'll really have to move part of the deltoid, so hide that, and then you'll have to move part of the biceps brachii, the long head. And what you'll see underneath is this small muscle that attaches kind of medial side mid-shaft of the humerus all the way to the coracoid process of the scapula. So that's your coracobrachialis. And this muscle does help flex the arm. And we didn't really talk, let me go back one here. The pec major and the pec minor, well, these have slightly different actions, and I'll talk a little bit more when we get to the 3D here. So, but basically your pec major is going to do this, and your pec minor is going to work more on your scapula. Now this one, deltoid muscle, is going to be this kind of like cuffed shaped muscle, and it's going to insert here in the humerus and the deltoid tuberosity. And you can see the origin is over here all the way along the spine of the scapula over to the clavicle, so you can take a look at that as well. This muscle, depending on the portion, right here we're looking at the lateral portion of it, that's going to abduct your arm. The anterior portion is going to flex, and the posterior portion is going to extend. Okay, and this is going to be the glenohumeral joint that it's moving. Okay. Other anterior view muscles are going to be, one of the big ones is a biceps brachii. It's got 2 heads, so bi meaning, and seps is head, so 2 heads, biceps brachii. Brachium means arm, and you can see there's some distal attachments here. The short head is going to go up to this coracoid process, and then the long head is going to go up over the head of the humerus, and then you'll be able to see this on visible body and attach to this supraglenoid tubercle. Okay. Here's another view of the biceps. So this, as far as the shoulder is concerned, it's the long head that's going to flex the shoulder. Okay. The short head really works at the elbow joint. Okay, so here you can see this long tendon. It's going to go through this intertrabecular groove, also called the bicipital groove, and then over to that supraglenoid tubercle. Okay, here are some posterior view muscles. So what can you see here? Got some better pictures of the rotator cuff muscles, and we'll talk more about that. But we have the teres minor, infraspinatus, and supraspinatus. The other muscle, the subscapularis, is anterior. So those are the muscles of the rotator cuff. Here, posteriorly, you're going to see at least 2 of the heads of the triceps brachii. Remember, tri meaning 3, and brachium is going to be the arm again. These are all going to attach distally to this olecranon. Okay? So these muscles, as far as the shoulder is concerned, are going to extend. The long head is going to extend the glenohumeral joint. Okay? And these, the medial head and the short head, they tend to do a little bit more at the elbow joint. Okay, let's go on to the next one. Now, you might be saying, Dr. Knice, why are you throwing this in here? This looks like a back muscle. Well, it is. It is a back muscle. However, if you take a look at the fibers of the latissimus dorsi, they come around the humerus, and they come from the back to the front to allow you to extend. Again, extending the glenohumeral joint. So that's why we have that muscle in there. You can see all of these on the muscle table. All right, it's a big, broad muscle, pretty strong muscle. All right, moving forward here. Some more pictures of the triceps so you can see the medial head now that we've moved the lateral head and the long head. So the medial head, I think I may have said the short head, but it's the medial head that's the deepest. Got a lateral head and a long head, right? And up here, this is really where this attachment is of the long head. It's right on the scapula on the infraglenoid tubercle. Okay. So these are shoulder extensors, and they also have motion at the elbow joint that extend the elbow. All right, a little bit deeper view so you can see a few other muscles. And we kind of had to remove some of the deltoid here so that you can see the teres major muscle coming from the end of the scapula and then inserting onto the humerus. You can see that muscle here. The other one, you can see the lateral head's been cut. I was just trying to see if they put, no, they didn't put some of the other muscles on there, but you can see that fairly well. Again, another posterior view here, really highlighting some of the posterior aspects of the rotator cuff muscles. So really far inferior, and it's actually cut, is going to be this teres minor. Below that's the teres major, which is not part of the rotator cuff. We've got the infraspinatus muscle and the supraspinatus muscle. And I'll show you some pictures where it's a little bit more evident what these muscles do, what their function is. Okay, so here you can see some of this here. So here's, just to orient you, here's the spine of the scapula. Here's the supraspinatus muscle. It's going to go from this fossa, the supraspinatus fossa, underneath the acromion and then over to the humerus, specifically the greater tubercle. And that's where pretty much most of the rotator cuff muscles are going to attach, just different areas. Here's a superior view, which is kind of nice. So what you can see here, and this is what I want you to appreciate, with these rotator cuff muscles, they kind of hug the head of the humerus. And that's because one of their functions, not all, but one of the functions is to stabilize the glenohumeral joint. So having these muscles, these small muscles, nice and strong, really help you stabilize that joint so that it perhaps doesn't dislocate or doesn't cause pain. There's a number of reasons why you need the stabilization there. And then the other thing that you can see here from the superior view is that this acromion is really on top of the supraspinatus muscle, and it's got to fit underneath here. So if there's any swelling, inflammation, scar tissue, that could really cause a lot of pain in the shoulder joint up there. Okay. Here's another posterior view. So we're looking at 3 of the 4 rotator cuff muscles, the supraspinatus, the infraspinatus, and the teres minor. And these muscles, here's the origins, and here's the insertions. You can see most superior, and that kind of makes sense, right? The supraspinatus, followed by the infraspinatus, and then followed by the teres minor. And then on the front side, and it should have it here, yep, here's your subscapularis. Okay? So you have that right here. And so if we go back, these muscles, if you can imagine some strings going from here to here, from here to here, and here to here, it's going to take that, let's see, if I take here we go, got something here. It's going to take that humerus and twist it out. That's called external rotation. And that's all based on where the attachments are. Attachments is a general name for the insertions and origins. We can see here. All of these, if we pull it this way, it's going to take and rotate externally, okay, the humerus. What's different about the subscapularis is that this is going to internally rotate the humerus. Okay. Okay, so that's your subscapularis here. And what's different about the subscap, even though it's part of the rotator cuff, it actually attaches to the lesser tubercle of the humerus. Okay, so what I'm going to do right now is I am going to stop the video. I'm going to create actually a separate video with just the visible body stuff. So I'm going to continue on in this video to finish up the glenohumeral joint, and then you'll be able to look at the visible body stuff as a separate video. And this way, it's not so long. All right, so when we're talking here about the bony features, okay, here's a radiograph, and just to kind of give you an idea, here's your humerus, here's the head, here's the lesser tubercle, greater tubercle, here's your clavicle, acromion, and over here is the glenoid. Okay. And here are some pictures, again, of the bones that make up the glenohumeral joint. Okay. And then if we look where this attaches, we're kind of attaching to the sternum, right? This is this really strong attachment, this sternoclavicular joint. This is the manubrium part of the sternum. I put S here, but this is really the body of the sternum, and this is the xiphoid process. So just to put this in perspective, and of course you've got your respective ribs around there. Now the clavicle, it's this kind of long, flat bone. On one end it's convex, that's the acromial end, that's the distal end. On the medial end is more of a concave structure. There's a large disc that sits between the sternum and the end of the clavicle here. Okay, so there's like kind of like meniscus, but it won't move like the knee moves, but that's really the same type of material there. And then there's different areas of attachments for particular ligaments, and here you see a couple of those, but we're not going to go over that right now, not the ligaments. Okay, so here what I'm suggesting that you do is pause the video, answer these questions, and I will come to the next slide and answer these. So the answer to the question is, this is a right arm. So this is what the things that I look at. This is the spine of the scapula. You can see the superior border. And then if you take your humerus, like I did here, I really patched it out, you can attach it to the glenoid, and that helps you visualize what the glenohumeral joint looks like and tells you which side it is. Okay. So now what I'd like you to do is pause the video and take a look. Go ahead, use your phone to get visible body on your phone so that you can kind of be brought right to the shoulder, and you can look up these next bony features. Okay, so I won't go over these here, but you will you'll be able to see each of these. Okay, so you're going to look up all of these on the scapula and on the humerus. Okay, and take some time and go through that before you kind of move forward. And the last aspect of this particular video is, what is this glenohumeral joint capsule? Well, if you take a look at this picture here, kind of sliced, so if I were to take like kind of anterior to posterior slice, so we're kind of going right through the mid-shoulder, that's really what we're seeing here. And that's the way that we can see the inside. Here's the head of the humerus, here's the glenoid, okay? Around all of this, if we didn't cut it in half, you'd see this kind of capsule coming around the head of the humerus. And then there's some bursas in here. We'll talk more about those during the anatomy, the actual anatomy class. Here's a very small disc in the acromioclavicular joint. Okay, but what's important to see here is, see how there's like a little sag here in the capsule? The capsule's loose, and you need it to be loose enough in order to move your arm through space. So if you imagine, and here's a good example, I'll probably use this example during class too. If you take your shirt and you hold on to the armpit, okay, That's a way of mimicking the bottom part or the inferior part of the capsule. Try to lift, you can't lift up, okay? But because we have a little bit of extra room in this capsule, you're able to abduct your arm. You're able to flex your arm, okay? And then here's just one view with the whole humerus taken out. Look what you can see here. So if we take this, let's put this in perspective. Here's your coracoid process. This is anterior. This is posterior here, your acromion. Okay, and then we took the whole bone out. So now you're seeing what's inside. Well, here's this big labrum. And the labrum is basically, if you imagine there's like a really small area for the huge head of the humerus to articulate with. Well, we need something to kind of make it a little bit more stable. Besides the rotator cuff, you've got the labrum that kind of, if you will, it's like it's a suction and it holds the head of the humerus in there. So that's what you see all along here, this kind of bluish color. And what's kind of stuck in here, it's actually inside the capsule, is the long head of the biceps brachii. So you can imagine if, again, there's some pathology, there could be some tearing. If you tear this part of the biceps tendon, you may tear some of the capsule. So these are some things that we look for. So what I want you to be able to see here is here's the bone, here's the glenoid, and then here's all that extra cartilage that helps stabilize a little bit. This is called the labrum. Okay? And I think that's all I have there. Great. So stop now, go through your tasks, and I guess you could watch the video, the 3D video, either before or after the task. So whatever works for you.